Good morning. My name is Marek, and we're going to talk about, for Healthline, health insurance and benefits, tips and tools for being a healthful consumer. My name is Marek. I'm a licensed independent insurance and benefits agent in the state of Texas. Health insurance and benefits, what is it? Health insurance indemnifies an individual or family from financial loss associated with the cost of treatment for illness or injury. Purpose of medical insurance is to indemnify you so that you don't have to sell your home, so you don't have to incur catastrophic financial loss. And as we all know, unfortunately, the state of our world is that medical care, while we've heard last week and we continually will hear about wonderful treatments and what's available, it's expensive, and it's not going to get any less expensive. And so the purpose of health insurance is that everybody should be prepared in understanding. All my purpose is to give everybody an understanding of what the system is and to not be scared about it. We live in a great country. There is plenty of assistance available for everyone. I would encourage everyone, please tell everyone, do not forsake medical care because of finances. Just please don't do that. And unfortunately, many do. Many people forsake going to get health care because they're afraid, well, how am I going to pay for it? How am I going to pay for it? I can just tell you there's lots of help out there, and it's available. Health benefits, which also health insurance is a little bit different from other insurance, is that it is a benefit. Medical and health insurance, the majority is bought through two ways. One way is through employers. If you're employed, you have a medical plan that's called a benefit. And also we have a workers' compensation system. And then also we have government, which is Medicare and Medicaid. The rules and regulations, the regulators that govern health insurance and benefits is number one, the federal government, and also the state government. That's the government entities that will govern and issue all the rules, and where Medicare, for instance, Medicaid, healthcare.gov, all of those are programs designed to provide federal or state government assistance, which, who is the government? We're all the government. And so through a system of taxes and socialization, which is what it is, we provide ways for everybody to make sure that we indemnify everybody from catastrophic financial loss. And make sure also the purpose is that, again, please don't ever hesitate to go seek medical care because you're worried how to pay for it. Workers' compensation is the system that started, is the first really system that started in the early 1900s. It's interesting as we read, especially as a Seventh-day Adventist, we can have a historical perspective that we read about in the 1800s about all the issues with health. Well, the idea of indemnifying and helping and making sure that people were able to seek medical care and not be concerned about it really started in the early 1900s. Started with the workers' compensation system. Believe it or not, the state of Texas was the area where medical insurance actually started. Blue Cross Blue Shield, Dallas, Texas, in the teacher system. And subsequently, everybody knows that where we've gone from there, we've gone through Medicare, which was in the 1960s. We continually have federal government rules and regulations which are part of that. Plan types, as I said, employer group, Employer group is where if you're employed, your employer provides a way for you to be insured. There's also direct primary care. One of the areas that's really helping a lot of people now is that you actually can go to a primary care physician, many of them in town, and you actually can subscribe to it. And what the primary care physician will do is basically be your private physician. A very good way, again, for affordability, so you can subscribe for a fee and be able to make sure that you have a doctor, an MD, a primary care physician that you can develop a relationship with. Concierge medicine, a little bit different for those who, depending upon where your financial situation is, concierge medicine is MDs that you can, again, subscribe to so that you can have a private doctor. What's been lost in the system, unfortunately, is really the individual doctor-client, doctor-member relationship. And there are ways that are trying to get that back. You can have an association. The association is if you're self-employed, if you are an independent contractor, if you're in those areas. There are associations which are trying to be developed. Unfortunately, needs a little more regulatory, but there are associations that you can have as well through various areas. And then there's the individual Medicare and Medicaid areas. One of the most important things to know, I think, is just this terminology. Many people get this mixed up, I know in my experience. A plan that if you want to get a plan, you want to make sure you have a PPO. A PPO means that you are covered, regardless if you're in network, out of network, anywhere in the United States. If you are in a PPO plan, you're covered. Okay? So that's something you want to always remember. You always want to look at having a PPO plan. An EPO is specifically a network. The network is sponsored usually by the insurance company. And then the HMO. The HMO came out, again, through trying to do cost savings and things of that nature. The HMO has come about, and many people have been very dissatisfied with it. And again, primarily because the HMO tries to reduce the cost by reducing access to providers. And so just be careful. If you need to be in an HMO, that's fine, but just make sure that everybody's in network, because the difference is with a PPO, you'll always be covered. You may have various amounts of liability. PPO, you're always covered regardless of the expense. And then HMO, you're not. You can have an expense, and actually you can still have a liability. And then indemnity plans and term plans are also out there for those of you who don't have access to one of a PPO or otherwise. Components, renewability, underwriting, deductible, and coinsurance, all of those are components of a plan. The main plans you want to look at there's two types. One that's approved by the federal government and the state government, and those that are not. I recommend you always look at having a plan where the federal government is regulating the benefits so that you know that you have everything included. If it's not available, or if it's not affordable for one reason or another, then you can look at a plan that is not regulated in that way. Components, again, daily benefit, maximum out-of-pocket, maximum benefit, premiums, benefits, all of that's included. All of that, what you want to do is you'll get a summary of benefits and coverage that's included. Please go through that. Take some time, read it, understand what your benefits are. And then also we want the components of a plan. We look at all the various components. Again, the difference is with benefits, it's either regulated by the federal government or regulated by the state government as far as what's in the plan, or it's not. And so that's why I always recommend getting a federally regulated plan, regulated by the Affordable Care Act. And then we look at also the various components of the plan. The additional benefits, you can look at as far as all the different capabilities. And again, all the benefits are related to the regulatory environment. And so, if you have any questions, be happy to help you with that. Also, plenty of available resources. Number one, the Texas Department of Insurance, Texas Department of Insurance website, Medicare.gov, Healthcare.gov, all those different websites. There's a lot of information available out there, available. Take advantage of it. Good luck. Like I said, if you ever need any assistance, let me know. But also seek the help of your professionals with your employer and also with the Social Security Administration, as well as the Texas Department of Health and Human Services. All those organizations are set up, and government organizations are set up to help. Thanks a lot.